AOFAS follow-up, just some thoughts on my way home, uh, talking about tibial-sided fixation. And there was a paper that was presented that talked about lucency on some of these lower profile tibial trays. And that was an award-winning paper at like 6.5% of lucency that was seen on X-ray. And some of those ended up being loose. And one of the things that I took away from the symposium was that we do think about tibial fixation, and it's a little bit of an unanswered question in terms of when do you go to something that has more stems or more robust fixation into the tibia. But the thing that's important to note is that the tibial sided fixation that has stems is not going to fix the deformity. You still have to fix the deformity. You still have to get the foot right. You have to get the ankle balanced. And if you don't do that, it doesn't matter what the implant is. And so I think that's something important to keep in mind when making a decision on the type of implant that you want to use in the case. Totally reasonable if you are a little bit more concerned for whatever reason on early loosening or more stress on that implant to make the case to use a stem, but don't use it from the perspective of balancing the joint. One place that I think was interesting to ConMed's Total Ankle in their planning, their patient-specific planning, the jigs or the guides they had are almost honeycomb, so you could look almost into the implant to see what the fixation was like. You can cut through the guides, what was interesting, and their planning software seemed pretty user-friendly. So something to think about if you're looking at some different options for patient-specific guides and total ankle arthroplasty. Hope everyone had a safe trip home. Cheers.